Fair warning for our listeners today, this episode contains content related to self-harm. If you or someone you know is struggling, help is available by calling or texting 988 or sending a chat to 988lifeline.org. Welcome back to Product and Health Tech, a community for product leaders by product leaders. I'm Nicole Harris-Roberts, Director of Marketing at Vinyl. Today, we're going to dive deep into a discussion I had with Sonia Garcia, co-founder and Chief Product Officer at Amae Health. Amae Health provides psychiatry-led integrated care via outpatient physical and behavioral health services at in-person clinics. As an engineer and a designer, Sonia recently was recognized by Business Insider in its 30 under 40 healthcare leaders who are transforming the industry. We discussed holistic care for patients and families who are affected by severe mental illness, and she talks about the power of listening, how to measure success, and how her mission-driven company incorporates empathy at the heart of product development. Let's get into the conversation. Sonia, you are the co-founder and chief product officer at Amae Health. We are so thankful that you made time for the product and health tech community today. Welcome to the show.
Of course. Thank you, Nicole, and really appreciate the feature.
It's really exciting to see where Amae Health is going and where you're kind of taking it. Tell our listeners a little bit about your story. Now, and I'll preface this by saying you can Google Sonia Garcia and you will find a lot of interesting information. So I know you've gotten various versions of your story out there already. For those who don't know, tell us a little bit about your background and why you decided to co-found this particular company.
Definitely. I'll start with the very beginning of my background. My family is originally from Mexico and Puerto Rico, and I grew up in South Texas. And it's largely Hispanic down there, really great town known as McAllen. But when I was 16, I tragically lost my dad to suicide. And it's always hard to say, frankly, but it completely disrupted our family life. It disrupted our community. It was a really difficult thing to go through. I'm the oldest of 5. So it was my mom, myself, me, and my 4 siblings trying to battle and figure out how to properly move on, what to do. We didn't really know about therapy. We didn't know about support or resources or grievance counselors. We didn't really have knowledge over how to seek help, much less from who or where. And so we went at it alone, and it was a very difficult process to the extent that one of my siblings, my brother in particular, I think took it really hard. And ultimately, he ended up going through his own battles with mental illness. And schizoaffective disorder was what he was ultimately diagnosed. And, within the family, we at that time understood now what the worst case scenario would be if we did not get him the right treatment in time. And so it was quite a scramble, and also this really big determination, coupled with unfortunate frustration to just get help. And so we went through several cycles of trying to access health systems, psychiatric hospitals, different, community health centers and things, and just being met time and time again with really long wait lists or not a good fit or really costly and prohibitive, factors that ultimately weren't, getting him through the doors. If I'm completely honest, we ultimately did not get the right care for him until we went back to Mexico. That was something that after the 4th or 5th hospitalization, we just said, this is enough. Nothing is changing. It's only getting worse. We're not finding the right level of resources here. And I found a clinic in Monterrey, Mexico. And that's where he got better and got stable and started returning to a little bit of normalcy. I'm super happy and proud to share that he just graduated with the master's in mechanical engineering this year.
Wow,
he had a
congratulations.
Thank you.
Yeah.
It's huge. It's huge, right? Like
that is huge.
To see just him battling and suffering and struggling to now he's thriving. He's living in Austin, Texas. And he's getting back on his feet and is wanting to work as an engineer and obtained a master's from UT RGV. And so I couldn't be more proud, and I couldn't be more grateful that, the treatment ultimately worked. And it was a holistic type of model where the family was incorporated, culturally competent care was being delivered.
Yes.
He was able to exercise. There was a nutrition plan. There was so many different aspects of his treatment that were all working in tandem and working together to get him better. And it worked, right? It was incredible. And so, as a caregiver to him, that was something that I got to witness, front row, front and center, and began understanding, oh my goodness, when you integrate these components together, look at these shifts. When you first establish, a healthy sleeping pattern, that begins to form a foundation. Then you can add on, better eating. Then let's make sure that there's an exercise regimen applied. Then, yes, let's check on the medication and how well he's adhering and how well that's working. But there are so many other factors and elements that play into this, and especially him being connected with family. We have a lot of family still in Mexico. And so it all came together in this really great, incredible way that resulted in good change, resulted in good outcomes, resulted in him getting better. And that was absolutely one of the pinnacle moments where I said, I have to just dedicate my life to this.
Wow.
And when I was 16, that was that very young turning point of, you're a teenager, you're figuring out what you want to be when you grow up. It led me into biomedical engineering to start. And so that was something where I was like, oh, I have this strength and skill set in being really adept with problem solving and dealing in calculated structures and having big challenges to take on, and thought that through biomedical engineering, I would have a really great platform to improve people's quality of life. And so I started with, prosthetics and medical device design, and did that at Rice University, and moved into health strategy consulting. And that was after graduating, where I was working with health systems, Medicaid, health plans, gearing up on plans and strategies for future optimization, innovation, their next vision. And it was a really great opportunity. All the while that was happening in my career was where my brother was getting that support and care and going through his particular journey with mental illness. So balancing those two things, it was a fascinating dichotomy to be, one, in a professional setting, understanding what's top of mind for a lot of these executives, a lot of these big systems, where, are things breaking, getting an inside look, and running over and observing how this is put into practice, what type of care my brother's receiving, where the shortcomings were. And so I was fortunate to just have that simultaneously and really do a lot of learning concurrently throughout that.
Absolutely. First of all, thank you for sharing your experience. These are not easy subjects to handle. They're not easy subjects to hear about. But when you start to share your story, you realize that there are more and more people out there who need to hear that, well, number one, they're not alone. There are resources that are available nationally and locally, but, more importantly, your experience you have a professional experience where you're in this consulting firm and you're working with the big executives, and they're thinking very high level about how do we serve large populations, right? And then you think about your brother and bringing that to the heart, right? My next question is going to be all around empathy, and you're right there. I mean, I think it's very hard to do what you do without empathy. So can you speak to what, in your view, is kind of empathy? What is empathy's role in product development and product management?
Such a good question. And one that definitely fuels everything I do. I'll just provide some background. Following consulting, I went to Stanford to do a master's program in engineering design impact within the School of Design. And I got to do a master's thesis focused on mental health innovation. And in there, within the design school, is where they have the school of thought and a lot of discipline applied to user-centered design, empathy-driven design. And so I had learned and studied a lot about this. I had lived it, but then I got formal training, formal studies from Stanford within this, and just uncovered how it doesn't, you don't have to have gone through what we went through as a family. It doesn't have to be at that end of the spectrum. You can definitely imbue empathy in many different ways, shapes, and forms. as you're building, as you're designing, as you are creating something. And it starts with understanding who your end user is, which is a hairier problem than you expect. And, you talk
All
about
those user
product market
experience
fit.
researchers who are listening, we see you.
We see you. It's really tough because people are so dynamic, and you can think about one super user or one ideal optimal user, and then think about other areas in which others could benefit and other profile types and personas. And you start crafting and creating, and you can mock up so many different styles across this of who's using this and how, and what is their lifestyle like. But you don't get close to the reality until you're up front and center, and actually seeing these users in their day-to-day lives, or getting FaceTime with them, and being as close as you can to understanding their needs, their pain points, what they're currently doing, their workarounds, right? If there are no solutions in place. And that just begets so much empathy, because you're in their world for a day, an hour, whether that's through, an empathy interview, or you're on the ground doing observational interviews, or you're, you lived it yourself, and you are some of those end users,
Yes.
or like a adjacent to the end user. And you just begin to foster so much empathy, which is so different from sympathy. Sympathy is where you have a feeling of sorry, like you feel bad for a situation. You can extend sympathy to say, you must be going through something really difficult. And I'm sorry. My deepest condolences, deepest sympathies go out to you. But you haven't taken the leap over the fence. It's kind of like you're saying it, and you're at that, you're just at that fence. You stopped right there. Empathy totally tears down the fence and says, I'm coming in with you. Like, I'm coming to the other side, and I'm helping to see what you're really going through. And I want to empathize and connect with that on a much deeper level, to understand you and to understand your experience.
Seeking that genuine understanding, isn't that what, great product pros want to do, particularly in health tech? I'd love to hear more about your process for kind of bringing in that voice of the customer or ideal user throughout your product development life cycle. So how once you, you're such a wonderful ambassador for people who are, suffering from mental illness, but also to be a caregiver. How do you incorporate those learnings into your product development process?
A lot of it has to just do with getting out there and listening, and getting the people that have been through this to dictate some of their journeys, and just openly trust and weigh in on what they've done and what they've gone through. When I started this work, and this has been many years building, right? And a lot of people reached out at the beginning because of what we went through as a family, to say, hey, we've gone through that as well. Or what have you done? What resources can you point me to? Throughout my brother's journey as well, they said, hey, I also have a loved one. I'd like to understand how you're getting him help, how you're getting treatment. And now, the closer I've gotten into this work, and now within Amae, a lot of people are saying, hey, I myself have gone through this, or I know a loved one who has. Can I put you in touch? Can they share what their journey has been? And every time I get that opportunity, absolutely, it doesn't matter what phase of work we're in or what stage of the company we're at. It is so important to continuously be intaking some of those perspectives and specific journeys. And so what happens is, then I'll reach out. With COVID, it was a little bit difficult. If I can do this in person, I think that's absolutely the best thing you can do, to sit face to face with someone, look them in the eye, tell them, it's okay. This is a safe space for you to share what you've gone through. But otherwise, we'll book a Zoom, right? At least a video conference, set a time, and then I'll just listen, and I'll put up maybe a Figma board or a digital whiteboard to say, do you want to map out like how this experience has been for you? What are the different components? Help me understand where it was the hardest. Help me understand where you were lost and frustrated. What really broke you? How did you feel, toward the clinical setting, toward your family, toward those you were responsible for? And it is this opening conversation where you're so let into their world and their perspective on what's taken place in their life. And, you literally lifting all the covers up to say, wow, it's not just, I went into a clinic, took some medication, came out. It is so many of the details of how I felt, whether I had a sense of control or not, how I was treated in the small exchanges, who was I accompanied with within the patient room, Did I go through an intensive, outpatient experience, or was it a partial hospitalization? And where did I end up after that? What happened when I left? Who was there for me? Like, did you adhere to treatment or not? And so to get these conversations, it unlocks your worldview and gets you so deep into what the individual experience is. And I do this a lot from the patient side, right? From those who have gone through the system, but it's also equally important to understand it from the clinical lens. And so we've brought together a really great team of advisors. We have a great CMO, Dr. Scott Fears, as well as a medical director of behavioral health, Dr. Gary Tsai. And their experience in clinical settings and in trying to imbue in integrated, whole person care, or multidisciplinary, compassionate, comprehensive wraparound services, substance abuse disorder care and treatment. And so you need to learn about that too, because there's so many intricacies that they've amassed throughout the years of their expertise and of being with hundreds of patients trying to do this and trying to get them to adhere to treatment, trying to get them to get to a behavior change. And so I think it's also important that you weigh not just the patient experience, but you also understand the other side of that coin, which is what happens in the system, what happens in clinical settings. And so from our advisors, from the medical director, CMO, right, that's who we also source a lot of that input from as we design and build.
Very important to see both sides. It's surprising how, I loved what you were saying about asking the patient, how did you feel when X happened, when you did this? And similarly, how did the clinician feel when they got the referral and maybe there's a blocker that you didn't know about, and without talking to them, you couldn't have possibly known. It seems maybe, how hard could it be? Well, turns out that it's pretty hard because of some silly reason, or, it's very revealing to see how they feel when having to do this at the volume that they're doing it, with the type of compassion that they continue to display patient after patient. That is not easy.
Yeah, 100%.
Yeah. I mean, so what are some of the kind of unique considerations you have when you're looking at, given how sensitive your customers are, and given how sensitive anytime we work with substance abuse issues, that it's a lot more complicated. And I don't think anybody would accuse people who work with severe mental illnesses as having an easy job. It's always complicated, lots of edge cases. How do you nevertheless achieve sort of a product market fit for Amae Health?
So first and foremost, we leverage a lot of tried and true methodologies and ways of treatment that exist today. So Dr. Scott Fears, our CMO, works within the VA, and he's integrated this model of whole person care, which brings in a multidisciplinary care team, does a lot of high touch wraparound services. What we also look to for examples are ACT teams, assertive community treatment programs and teams, where you're integrating into social services, community resources, really looking at it from the SDOH, social determinants of health lens. And there's a lot of best practices in those non-for-profit settings. However, they're stuck within those structures, stuck within the VA, applied to that specific population, or, in a little bit fragmented, disjointed, non-for-profit settings. And so we're bringing that together with best practices, bringing together the right folk, and then enhancing that model with a layer of technology that's really purpose-built for what we're doing within this integrated model of bringing the physical health, right, the primary care side, the mental behavioral health side and psychiatric aspect, and then the community side and services and support and reintegration into those social structures and community that's so, so important for true recovery. And adding that technology and adding the right team in a comprehensive way to really meet those needs. So that incorporates peers and the role of peers. And like I said, a lot of empathy that's derived from there, a lot of trust building that happens within that. Health coaches, I alluded as well earlier to the importance of exercise and regimen and sleep and nutrition. We have, it's like psychiatry-led, but we also have the social workers that are engaging in group therapy, individual therapy, all of the different components that are coming in together under one system, which we own and can control and can design for very intentionally to get the right outcomes. And that's another thing that's really important for us is the behavioral health industry and this aspect of healthcare lacks in standardized measurement and tools. if you make an analogy out to primary care, when you have a fever because there is a number that you can signal to say, I have a fever. And you can also even then say, if it's above or below a certain number, I know if I should go to the ER or
go to your nearest hospital or right.
Yeah. Within behavioral health, mental illness, like you don't have that. And it is so difficult. A lot of it is self-reported. A lot of it is lack of measurement altogether. And so we have a big movement and priority to bring in measurement-based care and infuse that into all of our systems and processes so that we are ensuring and have this regimented way of collecting a lot of that information, of tracking toward outcomes. And where possible, we're iterating on the treatment at a high frequency rate to say, hey, this isn't working. Here's the proof points that we need. How do we make the next decision? All right, now let's have some things change and move and be really, really flexible, because that's very important as well. The individualization that you bring into this while trying to have a certain standard of care apply to everyone. People are coming in with very specific prior traumas, couplings of diagnoses. There are also comorbidities. There are certain goes and no-goes within their cultural domains and where they come from and their backgrounds. And you have to honor all of that as a whole person to really get them to abide by a certain care or treatment plan and just have a lot of respect applied into that as well. Amae is this Japanese concept. My co-founder Stas and I are really fascinated by just all these Japanese principles and the way in which they uphold and protect and care for their community. And Amae is this concept that you can't go at it alone. You need the support and ability to depend on those around you in order to build yourself back up. So that fuses into everything that we do with, it's not up to the patient themselves to come at this and be responsible and put all the pieces together and go back and forth and manage appointments. It's hard enough as it is. And they are struggling with their mind. And so when you have that, you have to imagine how difficult it must be to rationalize through any type of decision, much less have, the foresight to plan, much less have the ability to abide by a schedule or care for yourself and do the basics even.
Right. So. Have you eaten today? Right.
Yeah. My brother wouldn't eat, wouldn't shower, wouldn't sleep. But we had to be there and say, look, let's try again. There was a lot of compassion met with persistence. And I think that's what we're also trying to bring to life here is
compassion plus persistence.
Yeah.
And the total and community have banding together, finding that tribe of yours, finding that community. I mean, that concept of inclusion comes to mind. Can you speak a little bit about culturally competent care here? For example, the experience that your brother had in Monterrey versus in the United States. And he thrived in Mexico. So tell me what was different, you think, about his care experience in Mexico versus the care experience in the United States? I mean, there are lots of differences, right? But in terms of being him being seen and understood.
Yeah. And this is my opinion and my take, right? But I feel that the US is quite individualistic. It's kind of every man for himself and individual achievement and accomplishment. And, at 18, you're fly out of the nest and you need to be independent and you need to be on your own. In Hispanic culture and where we come from, family is so important. Your grandmother lives with you as she gets older. You care for the most vulnerable. You have a big household and you're not expected to leave the home right away. You're not, quote unquote, kicked out or need to leave. It's always a place you can return to. And so the value and importance of family and blood and community, it is so, so deeply entrenched within our culture. And the first thing that happened, and this was the most impactful experience for me, it brought me to my knees, was we drove all the way down to Mexico. We had taken him out of a psychiatric unit in the US in Houston, drove all the way to Mexico, get to Monterrey, get into the clinic. Immediately, 2 nurses come, rush to the car, grab him because they knew that there was some mania and psychosis still taking place, and grab him, take him into, behind doors, just like Gare, to get him stabilized. They let us know that he needs, to be sedated for a time, given that he's been so many hours in this exacerbated state. Out comes the lead psychiatrist from behind closed doors, just to the entryway, and greets us and says, "Hi, I'm Dr. Jose Castillo Ruiz. I'm going to be in charge of your brother, right, like, or your son. This is my clinic. Welcome." He says, "Welcome." And he says, "Step into my office. I'd like to talk to you." And
Right there, I just got chills. I mean,
I'm tearing
I can
up.
feel the love coming through and the compassion coming through.
Well,
in
it was
that
the
story.
first time that I had seen a psychiatrist face to face that was responsible for my brother's life. Sorry. Wow.
That is everything. Sonia, that is everything. That is everything.
I mean, in all our years of trying to get him help, we had never seen the psychiatrist. We had seen nurses, we had seen social workers, we had seen others responsible and under private practice. There was some exchange and interaction, but he sat us down, and for 45 whole minutes, he told us he asked me, "Who's Robert Garcia?" He just like said his name, and he wanted to understand what he had gone through and what he liked and what he disliked and what were his lived experiences. And I'd never had that before. So it just like brought us to our knees, and it was such a relief. I knew he was in good hands. I knew there was someone there, a human that was caring for a human. And that was just all I was ever asking for and looking for. And it gave us so much peace. And it was day and night. I can't believe I can't stop crying. Sorry.
This is one of the most important experiences in his life and your life too, as family. Thank God, like, he was able to find some place where he is seen as a person, as a whole person, right, not somebody who needs his med adherence plan adjusted.
It made all the difference. And so you bet your bottom dollar that's the kind of care and the compassion and the inclusion and the consideration that we're bringing to Amae.
Beautiful. I will share, if you don't mind, I have some loved ones who have gone through similar experiences. Mm-hmm. And your story is really moving to me. I just want to say thank you again for sharing that. You never know who's struggling. And, people who are caregivers or friends who have family members going through this don't wear it on their sleeve. So,
well, I'm sorry to hear that. And it's unfortunate how common it is. And thank you for sharing, but it is almost every conversation. It doesn't matter who I'm talking to, on what end of the system, someone comes out and will tell me, I also have a loved one. Someone I love is someone I've lost, and those are stories that stay with me. I don't forget when someone says, "Hey, I'd like to openly share that I know someone as well, that someone in my home, that my significant other, that I lost a son, I lost a daughter." And it really fuels the fire. I mean, I use that just as little coals to say, keep burning this fire. There needs to be change. We're way overdue for a new standard of care.
Yes.
And this is what we're here to do. We're really trying to redefine how severe mental illness is treated throughout America.
Where do you think Amae is with that? I mean, you're launching your product. Can you share any, if you're willing, any recent wins or things you want to tell our listeners about that you're really excited about that Amae is doing?
Yeah, I would love to. Within Amae, we are delivering brick and mortar care. I don't know if I also said that explicitly, but it's very important for this population that you provide an actual physical center and location, and that there's human to human connection and care taking place. And we're opening our first clinic in Los Angeles. And so there's a great deal of need there. We're in conversations with several health systems that are also going to be communicating back and forth with us on the patients that are flowing through their systems. And so we're opening our doors there and hopefully earning the right to grow after that. But again, within our model, we're being very intentional with it's in person. You don't want to rush too quickly. These are people's lives. You have to be very intentional with the type of center that you put up, the type of care that you provide. And only after you get that right, do you merit the right to continue growing and scaling from there.
Right. Well, congratulations. I mean, I'm going to say congratulations in advance, because as I always say, we in product live in the future. So to me, this has already happened, and I'm sure you must be counting down the days, the weeks before this happens, right?
Yeah, totally.
Yeah. Amazing. That's a huge milestone. So as you drive toward this milestone with your team, what are some What are some lessons learned you think would apply to the product and health tech community in general, just from your position as a, think of it as a co-founder, or as a chief product officer?
Yep. I would say, particularly, and I can speak from the lens of the early stage startup, really in the specific to the healthcare field, you got to get close to the end user. You cannot be afraid to be upfront, get personal, really understand. It makes all the difference, in particular with how many solutions are coming out, which is great. I would say the more the merrier. Healthcare has a lot of room for innovation and improvement, and it is still, unfortunately, quite a fragmented system. And so it's great to see so many new innovative players within this space, but take the time to understand first, build second. It makes all the difference in a lot of the ways in which you make assumptions, make decisions, what you end up prioritizing within the business. It's night and day, and you're building something right from the get-go, or as close to right as you can from the get-go, versus it being an afterthought, or versus saying, well, they need this, so they'll have to use it.
Right.
Not exactly. It's almost like it might be easier to stick to their old ways than adopt, this new care system or, solution. So I would say that's very important. And then within this stage, the only constant is change. And so how can you be a big proponent of living in that continuously changing environment and stay up to speed with all the different changes and new information that continuously flows in, things that, break, things that need to be iterated upon? It is something where it's not just one and done. And like, we built it and check the box.
Yes.
Everything about this continuously ebbs and flows, has, even like community to community, right? Within our markets that we want to expand to. I mean, our dream is to be nationwide one day, but every market looks so different. And you understand, what are the idiosyncrasies beneath that? What are the resources and current support structures? Are there community health centers? Are there psychiatric units in place, for us? And there are, differences all throughout, and also the norms, the standards, even the regulatory structure changes state to state. And so with that, we're not building something that's one size fits all. It's definitely built with intention and that individualization that is merited, to really deliver personalized, patient-centric, compassionate, and integrated care.
Integrated care, and also, regionally appropriate based on the resources that are actually available there.
Definitely.
Yeah, it's interesting to think about your first market in Los Angeles, that as a large population, having that infrastructure there is key. And your service offerings and your product are part of that environment as well. Do you have, in the spirit of being change ready, okay?
Yeah.
What are some changes or trends you are seeing in your specific industry or in healthcare in general that you think are that you're excited about?
One that I would say that's fascinating to me right now is, because we're going through so much of this change worldwide, is the virtual versus in-person care debate, and what's more efficacious and when does that apply? And one thing is access, another thing is outcomes. You're thinking about different lenses all throughout. And I think we're coming to that recognition that there's a time and a place for this to continue existing, that yes, access is important, but it only gets you so far. And then understanding there's a need for still in-person care settings for some of these conditions, like severe mental illness, right? Where it's almost like if you were trying to deliver oncology, could you do that just virtually? Like, no, like they need chemo. There's very specific treatments. There's a lot of support and needed visits that need to take place by having the person there with you.
Absolutely.
In a specific place. And so I think that world has been shifting, where we may have over-indexed on virtual only when we were beholden to that primarily due to COVID and for safety and response and regulation. And now we're coming back to saying, what's that happy medium, and how do we land in a balance that still puts, the right effective care with the patient, with the clinicians, with, everyone else involved in the right manner. And also this specialty holistic care. I think what I'm starting to witness as well is that for too long, there may have been too many Band-Aids, because there was so much opportunity. There's so much fragmented, aspects aspects of healthcare that make it really hard and that unfortunately didn't keep up with technology innovation or different regulatory and policy changes. And you can definitely add in a lot of band-aids, and it does solve some immediate needs. But I think there's being more weight is being applied to what does that end-to-end look like? And let's own all of it so that there's more control. And so there's a sustainable system. I'm caring for all the different needs in one setting, in one place. Oh man, that makes all the difference. And it makes way more sense. And you look at different systems throughout the world and you're like, oh yeah, why did we divide out all these things in so many different pieces when, it's all one mind, one body, one person.
I'm actually really energized by what you guys are doing, and hope that other people in the community will be energized as well to take what their passion is, even if it's a personal one-to-one experience within their family that they can take and use that to fuel that fire, to use your words, to deliver more and better in health tech, because the world needs you.
Thank you for your kind words. It's so, I'm not taking for granted at all. It's wonderful that we brought together a team that truly cares for the right reasons. And I know that when you grow and scale, and that might become a little bit harder, that everyone has that shared lived experience or understands that from a loved one. I don't expect that. However, I really appreciate that. And to the extent that that's, continue to be weaved into the fabric of the core of Amae, that's something I'd love to uphold as long as possible.
I love this conversation. Sonia Garcia from Amae Health. Thank you so much for being with us today.
Definitely. Thank you for the time and the platform. It was such a pleasure.
Thanks so much for joining us today. If you like what you heard, please follow us on LinkedIn, YouTube, or visit our website at productandhealthtech.com. And if you have ideas or suggestions, or you want to be a guest on our show, please message us at info@productandhealthtech.com. Thanks for listening.